Now, dear friends and colleagues, we are now in Galway in the office of Dr. Hussain Bhatti, and I'm going to talk to him about his clinic, about services he offers, and particularly about physiological regulating medicine. His opinion on that, his feedback on the products, and on the method. So, Dr. Bhatti, I know that you don't need introduction to most people in Galway and in many other places. However, could you say a few words about yourself for those who don't know you yet?
Well, thanks again for coming over all the way. I'm very happy, to see you guys. It's been only a few months that I came across low dose medicine and PRM. To tell you a little bit about myself, I'm a qualified medical doctor. I have worked in nearly all the main hospitals in Galway, in all different fields of medicine and surgery. When I was working in orthopedics in the 80s, late 80s, I hurt my back while we were trying to lift a patient from the operation, in the operation theater. After that, I couldn't do things which I normally did. The pain was so bad that I was on a fistful of anti-inflammatories. I was also not able to go upstairs to see my patients, so the patients had to nearly come down to see me. There were 3 orthopedic surgeons working with me, and all 3 of them saw me and they didn't know what exactly was wrong. At the same time, I was asked to attend a friend's wedding in UK. So I went over after taking a fistful of tablets to my friend's wedding. At the wedding, I met another doctor. He was a general practitioner who did alternative medicine. So when he saw me limping, he asked me, "Why are you limping?" When I told him, he says, "Listen, come to my clinic and I want to have a look at you." So my friend who was getting married, he said, "Look, he's a good guy, go to his clinic." So I went over to his clinic and he gave me 3 treatments: bit of osteopathy, some acupuncture. The rest is history.
So it was something very new to you back then, wasn't it?
Completely, because before that, acupuncture or other things were like fish roll, or was like mumbo jumbo. But after that, I was a convert, and that's when I decided to go and learn alternative medicine.
And how long ago was that? I'm sorry for asking that.
No, this happened in 88.
Oh wow, it's a long time ago. So you're a master in so many areas of complementary medicine.
Well, I don't know about that, but when just before it happened, I was training to be a GP, and in the middle of it, this all happened, and it just changed the whole outlook and everything else. Now, although I practice complementary medicine, but I have great respect for conventional medicine. Without that, I'd be lost. I use my complementary background because I have worked in medicine, surgery, orthopedics, psychiatry. I was in charge of the alcoholism unit for 3 years. I have a diploma in child health from the Royal College of Physicians and Surgeons in Ireland. So I have worked in most of the fields of medicine, and that always helps me with any patient. and I'll be lost without it.
Mm-hmm.
It's invaluable.
Mm-hmm.
But
Absolutely.
I love the work I do,
Mm-hmm.
and you know, as I was saying about recently, I came across physiological regulating medicine, and I became really interested in it after getting my training and meeting some of the other doctors who are practicing it. I found it excellent. Now I've been using this therapy for my clients, and so far the results are excellent.
Mm-hmm.
Absolutely.
And may I ask you, what exactly attracted you in physiological regulating medicine? You as a medical professional and you as a complementary medicine practitioner in so many areas.
The biggest thing was no side effects.
Okay.
And no other complications or contraindications.
Mm-hmm.
And I think that was the biggest one. And then after that, it was the studies, that it is evidence-based therapy,
Mm-hmm.
and that was very important
Mm-hmm.
as well. And going through those studies and going through some of those works, it impressed me very much, and that's why I decided to. So, of course, there are other things as well, but the most important thing is that one, the remedies work.
Mm-hmm.
The second, they're natural.
Mm-hmm.
The third, that they work on the whole human being. And fourth, individualistic. I think the medicine of the future has to be, because there's no such thing as one thing fit all.
Mm-hmm. Mm-hmm.
We are all individuals, and I find that you really have to look at a person as a whole and then find their individuality and work on them, and then the results really speak for themselves.
Mm-hmm. So basically, am I right understanding that in your view, physiological regulating medicine is a tailor-made therapy which you can adjust or make offer for each individual patient considering his conditions, his history, age, whatever else?
His or her.
Yeah. Oh yeah.
Sorry.
Yeah.
Yeah. Or any gender.
Mm-hmm.
So I think that is a very important part,
Mm-hmm.
of course, and I agree with you on that those things are very, very important.
Another question which is very important to us, to people who work with physiological medicine and with Guna products and Guna as a company. What do you think about training? Can we offer better training? Can we offer more training? What are your thoughts on that?
I think you're pretty good at training people, and so far, especially from you and Natalia as well, the backup is fantastic.
Mm-hmm.
You know, whenever I needed any help, you were always there. And now Natalia has also given me some new insight in the beauty side of some of the Guna products.
Mm-hmm.
So I really think I want to thank you very much for taking the trouble coming all the way today. But yeah, not only training but the backup, mm-hmm. and other if there is any reason for, we always get complicated patients and difficult patients who you would need to get some more insight from the people who have been using products for a long time. Mm-hmm. I think sometimes I ask you for more research, and which you always provide.
Yeah, it's our pleasure to do so.
Yeah, absolutely, and that makes such a difference to me anyway. Mm-hmm. I'm always keen to know more about products and new products, and especially natural and complementary products.
Mm-hmm. And affordability of the Guna products.
Yes, they are quite affordable. I'll be honest with you, and also, as I said, the person, you know, as some people can afford even the most expensive products,
Mm-hmm.
and some people, you know, find it very hard. It depends on their affordability, and that, but depends on their socioeconomic condition.
Mm-hmm.
So yeah, I mean, it is very difficult to answer that question. But yes, generally, an average person should and would be, I think,
Mm-hmm.
be able to afford majority of the remedies supplied by Guna.
Mm-hmm. As a medical doctor yourself, do you think physiological regulated medicine has a place in a conventional medical practice in the future?
I really, my personal belief is yes. You see, if you can get results, if there is evidence-based therapy and you can get results from it, why not?
Mm-hmm.
Why not? I really think it has. It has. And what I do in my clinic is that I combine different therapies to give better results. I use a needle-free medical acupuncture. I use a restoration of microbiome and gut therapy. I also use lifestyle medicine, which I find excellent for different conditions. I also use complex homeopathy, some herbals. So yeah, and nutritional therapy. So I really combine some of these therapies. Yes, I forgot to say that in my experience, in this world, there are a lot of stress and stress-related illnesses.
Mm.
So in the last few years, I went out of my way, although I have a psychiatric background, but I went out of my way to learn a little bit more about new therapies and new treatments in psychology. So I did a postgraduate courses in mindfulness and cognitive behavioral therapy techniques.
Mm-hmm.
And I find them invaluable, literally invaluable in my practice. Because I believe that nearly every person has some sort of stress, and there are so many stress-related illnesses around.
Mm-hmm.
I find the combination of all those with PRM and LDM give great results, really, really good results.
Thank you so much. It's such a pleasure to talk to you, and we had a wonderful time here
You're very welcome.
exchanging opinions and learning.